So the journey to date, it's been quite a big milestone just this week, but if we were to take it back to 2018, where Foxo was born, Foxo came out of the brainchild of my co-founders being two doctors, both in public and private. And they grew up together, they went to med school together, and yet they were still unable to communicate in the health space. So even though they had each other's personal details, professionally they couldn't communicate around a patient. So they introduced myself, and we ended up kicking on to developing a prototype, and that eventually became Foxo, what it is today, which is a communication platform purpose-built for health. So really around patient-centric communication, as well as being able to communicate internally and beyond with your extended network.
That's brilliant, mate. Let's back it up a little bit. So tell us a little bit about your personal journey before you got into Foxo, and then we'll sort of unpack the whole startup journey that you've been on.
Yeah, no worries. Well, I did dive in pretty hard there.
Yeah, you did. You went straight into it.
So look, I'm a designer at heart. So university, I studied communication design, and from there kicked off a digital agency with a few good friends of mine, and ended up departing a couple of years in, maybe 5 years in, to travel. And since then, I was always in the design and marketing space, and always within the tech space as well. So that was the vertical that I played in. So developing websites, products, apps, and all of that, been doing it for decades. And I come from a family of doctors as well. So uncles, my father, cousins, everyone in and around the family are in medicine at some degree. And then there's me, the tech guy, who was kind of the black sheep for quite a while in terms of not really following the trend in health. But I spent a lot of time in my dad's clinic waiting for him to wrap up and take us home. And during that time, I was really an observer of the process and how backwards the system was. And even through to today, a lot of things haven't changed in terms of how difficult it is to get progress and actually communicate. So when my co-founders approached and said, let's really try something, it was time to jump into that vertical, being health and using my tech background. So look, I've been.
I was just going to say, sorry, Luke. I was just going to say the reason I asked you that question is I wanted to bring out that design experience that you have, because I think that is something that the healthcare system needs a lot more of. We need a lot more design thinking, a lot more people thinking about design, and especially looking at the individuals that are involved in the healthcare industry and designing systems end to end. So I want to kind of draw that out because I think it's really relevant to your story as far as getting into the startup. And apologies as well, kind of stolen your thunder a little bit there, but I'm quite passionate about what you're doing and excited about it. So so talking about your journey, so you've got some doctors in your family, you've got some friends, you were raised sort of in and out of a clinic, you were observing, you're seeing these types of issues, and then an opportunity presented itself. So what was that like for you then? What did you go through after your co-founder said, hey, why don't we try and do something about this? What happened next?
Yeah, well, look, so prior to jumping in headfirst with Foxo, I was at a company called Megaport. So quite a long journey with them from startup through to ASX and beyond. And whilst I was there, I was really helping out with the brand, the marketing team, as well as assisting with some of the product work there. And it became a real passion of mine. And that was a really technical product. And we tried, we succeeded in making a very technical solution into a SaaS, easy to consume product. So I've taken all of those learnings around, getting operational, onboarding, scaling up into the health sphere, which is absolutely needed. So, looking at a lot of the products today that have been institutionalized across the big public sector and also through to private, those products and their interfaces are really quite difficult to navigate. And that's because, you know, they've been around forever, and they just haven't had that chance to really iterate like what we see across other industries. So, you know, I was really passionate, and always have been, to bring that over to health. And it's actually really starting to happen now as we see more and more startups enter health. And that is, you know, easy to use, beautiful interfaces, intuitive, scalable products that not only solve a critical problem, but enable that really quickly, and also bring with it a lot of benefits around iterative design. So we spend at Foxo a lot of time with our customers, working out what's working, what's not. How do we optimize workflows? How do we get people operational really quickly? So if we're to look at what Foxo is as a product, which is a wide-reaching network where we want to bring on anyone and everyone in health to use it, we need to make that as easy as possible for that journey, that customer journey, for them to get optimal. So, you know, a lot of the onboarding and the user interface and the queues is really important to have that nailed down. So, you know, if anyone were to jump into Foxo today, you know, I'd be really excited to see them jump on board and take their learnings. And we really do listen and learn. And it's been a big win for the product. You know, we've just onboarded a clinic quite recently, and they didn't need any hand-holding. They all got operational. They all found each other connected and started communicating straight off the bat, which is, you know, true SaaS style, which is, you know, I think it's lacking in health, and it's desperate for this sort of change.
Yeah, I agree. I agree. There's one of the big opportunities. Back in the day, I started coreplus in 2009, 2010, and there was just very little, if at all, software as a service type of solutions in the industry. And so based on the use cases and really working with customers directly, you can hear what they need and why they need it. And I think traditionally what software or technology tries to do is it kind of tries to make the tech fit the requirement, as opposed to looking at the requirement first and then deciding what tech will actually make it work. So, you know, it's kind of, I think it's important in design to actually focus on what we need and why we need it before we ask, how are we going to do this?
Yeah, couldn't agree more with you. And even, you know, that process that we implement is, we call it rapid prototyping. So yep. We use Figma experience design products where we can prototype it out without actually having to lay a little, you know, any bit of code. So we can present that to a collection of customers and ask them to step through that workflow before we even, you know, put it through the engineering team, which is, you know, you're going down the wrong path if you're doing that straight off the bat. So we already gain huge insights on, you know, what's going to work, what's not going to work before we put pen to paper. And, you know, it's just been a massive win.